I'm Dr. Vernacchio, and I've been practicing at Longwood Pediatrics since 1996. It may sound cliche, but what I love best about being a pediatrician is developing long-term relationships with my patients and their families, and seeing my patients grow up over the years. Now that I've been in practice for nearly 20 years, I've seen many of my earliest patients grow from being tiny newborns through their childhoods, and now I see them as young adults going on to college and out into the world, and it's very rewarding to have been a part of their lives for that long. I also find it amazing how many parents of teenagers and young adults will tell me how vividly they remember when I examined their newborn baby in the hospital for the first time, and how reassuring it is for them to have had the same doctor for their child throughout their entire childhood. And in my opinion, that's one of the wonderful things about Longwood Pediatrics. While we're big enough that we can be open 365 days a year and provide 24-hour-a-day phone coverage, we strive very hard to develop that personal relationship between each child and family and their own doctor, so that the family knows that in the end, if their child develops a serious health problem or they need advice about their child's medical care, there's someone who knows their child well and someone they can trust. Because of our close relationship with Boston Children's Hospital, many children with complicated problems are referred to see us, and we're very comfortable taking them into our practice. We have a great team of very competent doctors, nurses, nurse practitioners, and others who will work together to provide the care that those special children need. In addition to my work at Longwood Pediatrics, I spend about half of my professional time doing clinical research and quality improvement work. My research work is related to finding and testing new ways to deliver the highest quality care in pediatric primary care settings. For example, in helping practices to achieve the highest possible rates of recommended preventative health care services such as vaccines and routine screenings, and in devising ways to improve the quality of care delivered for common chronic illnesses such as asthma. I currently do this work through a network of over 300 pediatricians that are part of the Boston Children's Hospital community. I find this work to be a great complement to my work here at Longwood Pediatrics because it's very intellectually stimulating and forces me to keep up on the latest developments and guidelines in pediatric medicine. It also allows me to bring new innovations into our practice very quickly, and that's always exciting and really keeps us on our toes. So in the end, I really enjoy my job as a primary care pediatrician and a clinical researcher, and I look forward to many more years of caring for patients with my colleagues here at Longwood Pediatrics.